Okay, so the legal issues in this scenario, the first thing is it is a mistake scenario. Medical error happened. Initially, wrong information given to the patient. So whenever we are giving the wrong information or we are committing the mistake, there is a rule of A. This is
Apologize.
just like the rule of A's. You have to say 3, 4 A. Well, number one is admit that the mistake has happened. No escape way. Okay. So there is no escape way. Whenever the error happened, we have to accept, we have to admit that the mistake has happened. And I'm sorry that the mistake has happened. And I apologize from whole team. This should be the way. Okay. Then another A is actions. We have taken certain actions. What are those actions? Incident report has been written. We have to make this habit now, Dr. Vikas and all the listeners, that you will not say in the scenario that we will write incident report, we will go for root cause analysis and this and that. No, no, we have already started the process. Once the error happened, we have started the work. So what is your work? I'm sorry this happened to you, but it should be very in sympathized way, empathy and sympathy. Your words should be very polite. And I admit that the mistake has happened. I'm very sorry, and I am apologizing from whole team. Okay, and then stop from this point. You have to take the pauses, so the person should react to you. It should not be one-way traffic. We have to wait and go, and we have to appreciate the concern or the response of the person. So at this point, when you will say, I admit that the mistake has happened and I'm sorry and I'm apologizing from my team, from whole team, he will say who is responsible. So you can say like we are working as a team and we all responsible for this, and uh, we are we are working as a team again. So like this, you have to reply and then uh, proceed from there. Then he will give you a chance to speak more. So you will say that we have taken some serious actions about it. So what action you have taken, doctor? So incident report has been written, consultant has been informed, nursing in charge has been informed, and we have the system. In this system, we used to find out the cause, why it happened. So there is a procedure known as root cause analysis in our hospital, and we follow the all the rules and regulation, whatever there in good hospital. In our hospital, it is practiced. Okay, so root cause analysis has been started, and once the root cause analysis result is coming, whatever the recommendation they will give us, we will follow those recommendations, so such mistake will not happen again to any patient. Sometimes the patient can ask you, uh, do you think this time you did this mistake and you will repeat to do this mistake again? So you can say, no, I can reassure you, the root cause analysis team is on board. They are searching the cause. We will see what happened and why it happened. So we will follow the recommendation of root cause analysis team, so it will not happen again to any patient. That's it. Then he will say, okay, the mistake has happened, so I want to complain. Okay, try to make him calm and cool. Try to avoid the complaint by saying that I'm sorry. I know that uh, you are distressed, rightly distressed, and I appreciate your feelings. And we have already started this and that. Again, you can say a few words, and then. But if complain is your right, if you want to complain, I will I will guide you. I will guide you. So how you will guide me, or how you will help me? Better to say I will help you in this. Okay, how you will help me? So the pulse service is there, and this is patient advisory and liaison service we have, and I will help you to approach to them. Clear?
Yes, sir.
Okay, then the next point is the team has decided. So in this scenario, now the situation is changed. Your diagnosis is now the same diagnosis, but the disease is not curable disease. It is not a curable disease now. So we are not going for surgery. I'm sorry to say you. So now the treatment plan is changed. Okay, doctor, what is the plan change now? So we are not going for surgery. We will give you the total care known as palliative care. Do you know what is palliative care? No, doctor. Tell me about the palliative care. So it is holistic. It is holistic care. It is total care of the patient. It is provided to those patient who is having end stage disease, or this is given to those patient who is suffering from the disease that is not having the curative treatment. Is it clear to everyone? What is the definition of palliative care? It is the total care. It is not single thing. Okay. It is a total care for the patient who is suffering from non-curative disease, end stage disease. It provides total care to the patient. It keeps the patient pain free. It keeps the patient symptoms free. Whatever the symptoms you have, we will give you the best possible care to you. Okay. So main target for palliative care is to keep the patient comfortable in a dignified manner. Dignity of the patient will be prime important. Okay. What it includes, the palliative care includes whatever the symptom the patient is having, symptomatic treatment we will give. It includes nutritional support. It includes social support. It includes psychological support. It also provides spiritual support to the patient. And not only to the patient, palliative care also provides support to the family, because the closed one, the loved one is suffering from end stage disease, distressing symptoms for the patient and distressing for the family also. So we will offer to the family also, do you need any help? Okay. Then what is where the palliative care is given? Palliative care can be given in the hospital. It can be given in a place known as hospice. It can be given in the nursing home. It can be given in the patient's home. So we have to ask the patient where he or she wants to spend last days of his or her life. Okay. So this is about this palliative care. More about palliative care. Who is the care provider? It is multidisciplinary team. It is multidisciplinary team. Whatever the team is required, we have to include. In each and every scenario, it will be different. In cancer patient, it will be different. In some other end stage diseases, it will be different. Okay. So specialized team that include your GP, specialized nurse, specialized palliative care doctor, consultant. If it is cancer, a specialized cancer nurse known as Macmillan nurse. It includes social care providers, volunteers. In some communities, the community palliative team is also available. They provide service at home. Some religious personnel to provide the spiritual support. Frequently needed psychiatrist because they are depressed, they have mood issues. Nutritional dietitian specialist. Okay. And this palliative care also provide guidance to the patient for claims. In some cancers, there is in the patient, if it is related to the occupation, they can guide them for claims. You can go for claims if you are entitled. Okay. So social condition, we have to address the welfare of the patient also. So we have to ask the patient, whom do you live with? Whom do you live with? Or who is taking care of you at home? Do you need any help? And sometimes the patient is managing some relative. He is not a patient. Like this patient was stable since before. He was a stable patient. He is coming for curative management, but he is now having the disease that is not curative. So might be he is taking care of his father or mother. So in that condition, you have to modify your question also. Do you support someone? Do you take care of someone? Do you need any help? How it will be managed in future? Okay. Then you have to give him in this scenario. There is hidden agenda also. Dr. Vikas, you touch this, and because the time, if time was very limited, so you touched it. Very nice. So advanced directive, living will, and lasting power of attorney also we can suggest to them. Okay. Then discuss DNR. Again, after discussing the palliative care, you have to take some pause. You have to ask the patient, do you have any question about it? Do you need any help? Would you like to continue or should I stop here? And I want to discuss with you another important part of your management because today it is too much to give you this all bad news. So would you like to continue? He will say, okay, tell me what is remaining. Then you can continue. Otherwise, the examiner knows that you are going for DNR. Okay, so you can just touch this part of DNR if the time is running. So in this condition, what you have to say, don't say like we will not jump on your chest. Better to say because it is a end stage disease or it is progressive disease, it is progressing very fast. So sometime if sometime your heart stops or your breathing stops, we will not resuscitate you. Do you have any idea about this resuscitation? Sometimes the patient say, yes, yes. One of my uncle, he was suffering such and such disease, and doctors decided about DNR. So it makes the like he is having some idea. So it makes your job easy. But sometimes the patient say, no, no, I don't have any idea. So in that condition, you will start like this. If whenever your heart stops or your breathing stops. So
Sir, one question here. As what I know, ki once patient is having DNR has been decided by team,
yes,
then it cannot be override by patient
yes,
or the team
yes,
members. But as
yes,
here the patient told ki as I said that I will arrange a meeting with consultant. So is your consultant has the right to
done.
change the decision? So as it is consultant and team decision, so consultant